How you doing? My name is Ken Telich. I'm an occupational therapy student at the University of St. Augustine. Do you mind telling me your first and last name and your date of birth?
Yeah, it's Kyle Dayton, 21491.
Awesome. And do you know where you're at right now?
Yeah, we're in the University of St. Augustine.
Perfect. And do you take any medication by any chance?
No, no.
Okay. So I see here in your chart, Kyle, that you have some pain that you've been experiencing over the last couple months in this area, and where it's like usually called tennis elbow or lateral epicondylitis. Okay, well, something I would recommend for you is this modality, which is like something, it's like this little unit right here called the TENS unit. And pretty much what this does is that helps relieve the pain. And the way it does it is goes off this theory called endorphin theory. So we put these pads on, and it will trigger a muscle response. And that muscle response will send a signal to the brain, and the brain will release these endorphins. And these endorphins help mediate the pain that you're experiencing in your arm. So this will cause a slight muscle twitch in your arm, but you shouldn't be feeling any discomfort, anything painful really. It should just be comfortable, but experiencing a muscle twitch. So it can be kind of weird at first, but it helps mediate the pain.
Okay.
You might experience some redness in the area, but usually it shouldn't be anything serious, and it should go away in a couple minutes. Would this sound like something you would want to do?
Oh, yeah, definitely.
Okay, awesome. So before we go over that, I just want to make sure you're a good candidate for it. You need to make sure you don't have any of these contraindications or precautions. You don't have any cardiac conditions, right?
No.
Do you have a pacemaker by any chance?
Nope.
Do you have a history of epilepsy?
Nope.
Malignancies?
No.
Peripheral vascular disease?
Nope.
Okay. Do you have any decreased sensation in that area?
No, I don't think so.
Okay. Do you have any undiagnosed pain?
Nope.
Transcerebral pain, like any pain up in the area, in the head area?
No.
Okay. Well, and you want to do this over the carotid sinuses or the CNS, but since we're just doing it in this area, that's not a big deal. Okay, good. So I'm just going to check the sensation in your arm real fast. Do you mind closing your eyes?
Okay.
So just let me know if you feel my touch, okay?
Yep, I feel that.
Okay.
Yep.
Okay, and I'm just going to check to make sure the sensation is the same in both your arms. So just let me know if it's the same or different, okay?
Same. Same. That's the same.
Okay, perfect. Well, it seems like you're a perfect candidate for this. So what I'm going to do is I'm going to set you up with one of these units and also these pads. So before you put these pads on, you're going to want to clean off the area. So you can use some alcohol, some soap and water, some hand sanitizer, anything just to get all the junk off of it. And so you just would rub the entire area.
Okay.
Because you want that nice and clean, because when these pads are stuck on it, you don't want it to be stuck to any crap or any debris or dirt, anything like that. So to make sure that it works the best that it can.
Okay, cool.
Any questions so far?
No.
Okay, perfect. So where you're going to place these is around the area where you're experiencing pain.
Okay.
So since the pain's around here, you want to put one right up there.
Okay.
And then you want to put the other one. You want to put at least the pads length apart, so you would want to imagine it's right there, and then maybe somewhere down there.
Okay, cool.
Okay, and you want to make sure it's nice and flush on. Okay. And then for the settings, since we're going to do it, since you're experiencing chronic pain, there's different settings that you have on this thing, but I'm going to show you the settings that you should use to get that motor twitch to go off the endorphin theory, because that would probably be the best way to mediate the pain that you're experiencing.
Okay.
So you're going to go up here and see where the TENS S or TENS N is. So if it's not on that, you can press the mode to get it to there.
Okay.
And then you're going to have different ranges for your rate and for your width. So for your rate, you're going to want to be anywhere between 1 to 10. Okay. So you want to start off on the lower end, just so you're experienced, you can get used to it. And then probably as your body gets more used to the feeling, you're probably going to want to go up more closely to 10. And then the width is anywhere between 150 and 200. So again, you want to start off towards the lower end, and then you can work your way up.
Okay.
So you get that. So you hit the set button, and then you can use this arrow to change the numbers if they're not already set on that.
Okay.
And then when you do have that set up, you're going to want to plug this in. You want to plug it in all the way, make sure it's pushed down nice and tight.
Okay.
And then you're going to use this arrow right here to change the intensity that you're feeling.
Okay.
So you don't want to make it painful or anything too extraneous, but you just want to get to that point where it's perfect, where it doesn't hurt, The twitch isn't too bad, but it's just right.
Okay.
And then for the time wise, you're going to want to go anywhere between 30 to 45 minutes, because eventually past that, you're going to fatigue the muscle too much, and then it's just going to cause other problems that we don't want.
Okay.
So that's pretty much how you use this thing, and then you'll just hit start the time, and it will start it, and it will let you know when the time runs out. Do you have any other questions or anything like that?
No, I don't think so.
Okay, perfect. Well, if anything goes wrong, or if you're experiencing more pain than you feel like you should, make sure you call me, and we'll try to figure something out. Maybe if you need to go, like if it's any problem, we can try to help you out.
Okay.
Well, thank you for coming in,
All right.
and let's get this off of you.
Awesome. I appreciate it.
Okay, perfect.